think one of the things I find most interesting about this issue is that we're not really talking about the breadth and scope of influence that corporations have on our health when we talk about public health and medicine. I think people might think about product marketing sometimes, think about fast food marketing or alcohol, selling alcohol to children. And sometimes, of course, we know that product safety has an impact on health. When we see major recalls, we see toy recalls, food recalls, now car recalls. But I'm not sure that people really put that together with things like work processes. So occupational health statistics suggest that about 16 workers die on the job every day. And of course, we don't know very much about how to measure the impact that corporations have on environmental health through pollution. And then I think even less, we have a discussion about the effects of corporate issue management strategies on our public perceptions and on our policies. So for instance, corporations play a role in influencing trade policies, and trade policies have a big influence on whether countries can do things like ban tobacco or ban certain kinds of health claims, or even spend their money providing social safety nets and health care versus having to repay debts and other kinds of very technical issues. And in the United States, we've seen the effect of corporate issue management on public perceptions about health care reform, for instance. So as a result, we don't see the really big picture, and we don't focus so much on corporations when we think about our health status. And then I think the other reason that I'm interested in the subject is there are a lot of groups who are starting to organize to draw attention to this, who are looking at corporate campaigns as a way to improve health, and groups that are organizing to address the larger issue of corporate influence over society. Recently, there's been the development of Corporations and Health Watch. Is an example of an organization that is trying to put together these different pieces of influence. There's also groups like Ohio Citizen Action that work on environmental health, various kinds of citizen action organizations. And now more broadly, we have groups like Move to Amend that are really wanting to reform how we deal with corporate governance. I think the one thing I'd like people to remember is that my research on occupational health, environmental health, trade policy is not anti-corporate, actually. That if we improve the environment, the cultural environment, the political environment, for healthier, more sustainable corporate practices, it's good for society. That great scope of influence that it has, but it's also good for the long-term interests of corporations themselves. So the point of critical research is to reform society and not just to critique it. And so I think that we can work towards the development of win-win kinds of solutions, that we can pick the good models of corporate behavior and make those the norm, and that we can work together to try to remove the barriers to more sustainable practices.
That's great. Thank you so much.